You're welcome to Maxi Health, and today I promise that it's going to be a very exciting and fully packaged program for you. As usual, we have our various segments that will give us a lot of vital information to our health. My name is Dr. Margaret. Please stay tuned. Welcome back. This is the Doctor's Perspective segment, and today I will be taking a look at secondary infertility. If you can remember last week when I discussed about primary infertility, I basically told us that there are two different types of infertility issue, which is the primary infertility and the secondary infertility. And last week I gave us a whole download of what are the causes of male and female infertility when it comes to primary infertility. But today I'm here again to give us and throw more light on what secondary infertility is and what are the causes of secondary infertility. Alright, let me start by giving us a definition of secondary infertility. Now, when we talk of secondary infertility is defined as the inability to conceive after you have had one or two children in the past. A lot of people will be wondering, why is it that I can't get pregnant? Okay, I've had the first baby and I want to conceive for another baby again, and you're now finding it very difficult. It's not new under the earth. What might be happening that it might be a problem from either of yourself or either of your husband, and that is why it's always very shocking when people now find out that okay, or even people that have even had two children or even have had three children, and at the end of the day they now want to have another one, and it's kind of coming difficult. They find it very shocking that there's nothing wrong with me. After all, I was the same person that pregnated you, or I was the same person that got pregnant for you. You understand? And this has really posed even a lot of problems in some homes. Please, as couples out there, if your wife or the husband is not able to pregnate, or you're not able to carry another pregnancy again after like the first or the second child, please relax. Remove anxiety. Just take it calm and easy. Make sure medically you are fine. And then before you do it, another pregnancy will come forth again. Okay, now let me go briefly to what can cause this delay in male fertility when it comes to secondary infertility. The causes are similar to primary infertility actually, but there are like one or two differences when it comes to primary infertility and secondary infertility. Let me quickly go to the male reproductive system. The first one is problem with erection or ejaculation. Your problem with erection or ejaculation. Now, there are some people, maybe in the past, you used to have a very good ejaculation and used to have a very good erection. But now, the erection is not like before. Or probably maybe the ejaculation too is not like before. So, that definitely is going to cause delay in conceiving for the woman, because maybe before immediately you have your erection and now the erection is not coming forth, maybe as a result of maybe an infection or something, or stress, because you can't compare when you were not working, maybe after in your university days, so now that you are working, because you have a lot of things running in your head, you have a lot of things that you're thinking about, and this actually tells a lot when it comes to ejaculation or even erection issue. So one is probably there's a problem with erection or ejaculation. Okay, the second one I'd like to mention is problem with the semen. Maybe the semen doesn't have a very good active cell, or the morphology is not so fine, or probably the viscosity too is not so good. If you have problem with your activeness, that is your active motile cells, if the activeness is not up to like 50%, then you expect that it will not be able to swim quickly to go and mix with the egg so that there will be fertilization. The third one I'd like to mention is smoking. Maybe when you were in your university days, you didn't used to smoke, and suddenly you now got married, you have turned to a big man, then you started smoking. Reduce it, minimize it. These are things that could cause hindrances to you pregnating your wife. Now, another thing I'd like to mention now is some men have autoimmune system, which means they produce antibodies that destroy their semen. There are some men that have autoimmune system. They might not be having that issue before they had the first one or had the second one, and suddenly this thing developed in their body system. And once this comes to play, the antibodies destroys the semen, and before you know it, your count is just going low. Another point I like to mention is hormone disorder. Hormone disorder due to probably a tubal blockage. I'm sure people will be wondering, what does doctor really mean by hormone disorder? You know, men too have hormones. It's not only women that have hormones in their body system. Men too have hormones. If there's an hormone disorder, then definitely it's going to affect the rate at which your semen production is producing. Now, another point I like to mention is age also is a major factor. It is not only associated with women, but in men also. As men are growing older, men also become less fertile, and the rate at which you'll be able to pregnate a lady is reduced. So age is not only on the side of the woman, age also is on the side of the man. Now, that takes me now straight away to female reproductive system. What are the things that can cause delay in a woman not able to get pregnant, like she easily had the first pregnancy while she was looking for the fruit of the womb? The first major point I'd like to mention is ovulation disorder, such as polycystic ovarian syndrome. You know, normally when a woman has PCOS, automatically this affects her ovulation. And once there's no ovulation again, what do you expect? There can't be pregnancy. So ovulation tells a lot when it comes to a woman getting pregnant. Once ovulation has been disrupted, then there's a challenge for the woman able to get pregnant. And there are different reasons why a woman will have problem with her ovulation. Like I said earlier, I said PCOS, which is polycystic ovarian syndrome. That's the first major cause, ovulation. Number two is there might have been damage to the fallopian tube due to previous, maybe ectopic, maybe the woman had an issue of ectopic pregnancy before, or maybe she had an infection, or maybe she had the case of endometriosis. So if the woman has had damage with her fallopian tube, how do you want her to get pregnant? But if she still has one of the fallopian tube functioning very well, my dear, she can still have as many children as possible. What is the best treatment for secondary infertility? Early diagnosis and investigation with possible treatment is very important in secondary infertility. Immediately you notice that maybe you have waited, you have given your baby like 2 years spacing, and you are now trying and the baby is not coming forth. Early diagnosis and treatment is best advised. And by the grace of God, if you fall into this category of secondary infertility, if you can follow everything I've told you, I can assure you, even if you want 12, God is able to give you 12, even more than. Alright, that is all we have for you today on secondary infertility. Please stay tuned because the program will be right back.
Hello and welcome to Healthy Recipes. I'm your diet designer, Celia Penny. Today we're going to have pear and we have bread. I'm going to use pear for a start. Now, that's just for 2 slices of bread. Now, like I said, I like to add seeds to my bread because it's rare to find seeded bread around here. So if all that you have is the bread that you find around that are not seeded, you can always try to seed your bread. Okay, so I'm going to have to seed my bread using this sesame seed. Okay, sesame seeds into just add 1 or 2 spoons of that. You have soy cheese. Now this is what has formed from soy milk. Soy milk does not keep. Okay, if you keep soy milk out in normal temperature, it's definitely going to curdle. Okay, so, and of course you don't have to throw it away. It's not bad, it's not smelly or any such thing. Again, you can add a pinch of salt, and what you do now is add it, just scoop a bit of it onto your bread. Now I really do hope that you've learned just a little bit from this. Always remember that when it comes to your health, everything matters. I'm Celia Penny, caring for you.
What I'll just do is to keep on praying, because it is not her, neither me, that creates children, but God. We keep on praying, and I believe that God can change the situation. So I will not opt out. We'll just keep on praying, and there will be a miracle.
Well, to my own, I'm going to out of the marriage because I can't stay there without an issue. So it's not possible for me to stay there, so I have to back out.
Of course, I will remain in the marriage.
Okay.
Since my purpose of getting married is not only to have kids.
Okay.
So I will remain in the marriage because I believe that what can give me joy is not what people think can give me joy. So I won't listen to what people say. So I didn't have problem with that.
To run a test on 34 organs in your body, you can contact Dr. Margaret on 0807 176 7592 or 0803 778 3305.
Consumption tips you want to know about. 1. Opt for a healthy diet. 2. Vitamin C improves the fertility of the woman. 3. Limit intake of supplements. 4. Increase your intake of tea. 5. Keep up the right weight. 6. Avoid smoking. 7. Avoid lubricants. 8. Don't stress. And 9, the last, avoid doubting.
For sponsorship and advert placement, please contact Bimbo on 0807 176 7592 or 0803 778 3305. Welcome back, and this is the Ask Your Doctor segment. My mailbox is very full, but I promise you I will make sure I touch all the questions you have sent to us during the week. Alright, my first question says,
Hi doctor, I have a problem with the way I urinate. It's so frequent that I'm getting tired of it. Most importantly, I lost some of this urine when they come at night. Before getting to the toilet for this, I change my undies frequently. I'm also scared of traveling because I have peed on myself severally in a bus. I'm 21 and single and can't find any clue to why this is so. I was able to trace it back to when I was 14 years and think that was when I noticed it. I want a change on this because I'm sure it can't be normal.
It is definitely not normal, my dear. But I think you're very young for what you're actually going through. Number one thing is, the first thing I'll advise you to do is, you need to, I hope you don't have infection, urinary tract infection. That's number one. Now, number two is, I hope your bladder is not growing weak. Because if you are not able to retain your urine for some minutes before you go to pee in the toilet, even before you, like according to your question, you said even before you get to the toilet, you have already pee on your body. That means your bladder is growing weak gradually. But I think what I'll advise you to, because of your young age, if you know you cannot relate it with your mom, but I advise you that you relate it with your parents, then let your parents, give your parents my number, then you call me, then you come and see me at the office. Then I can now tell you one or two things to do. But meanwhile, you can run a urine culture, just for me to be very sure that you don't have urinary tract infection. But for the meantime, while you are still going through this, I think I would advise you that anytime you know you are pressed, you don't need to wait until you are very pressed. Get to the toilet immediately and pee.
Dear Dr. Margaret, in the month of April, day 2, I went for pregnancy test. The result was positive. On the 27th, I saw my monthly cycle. In May, the PT result was negative. Also, anytime I have intercourse, the semen comes out of me. I would like to know why my ovulation days.
Okay, knowing your ovulation days is not a difficult thing, as far as you know how many days cycle you have. But from your question now, you didn't tell us how many days cycle you have, so I might not be able to calculate for you. But I'll just give you a brief calculation for the most commonest days of cycle that most ladies have. But that does not mean that you have 28 days. You make sure you count your days of ovulation, and then you use the same method in calculating it. If you have a 28-day cycle, what you have to do is subtract 14 from it, and that will give us 14. And day 1 starts from day 1 of the menses to the 14th day. So your ovulation should be on the 13th, 14th, and 15th day. Now, apart from that, you also mentioned something about you getting pregnant. You know, none of us actually, because we all know the symptom of pregnancy, without actually getting to the lab to go and run blood pregnancy test, we just assume that we are actually pregnant. Meanwhile, we are not pregnant. So in that kind of issue, it's best that if you know that okay, you have missed your period for about a week, you don't assume that you are pregnant. Because like what you just asked now, you are assuming, I'm sure you assumed that you were pregnant, and now in the next month there's no pregnancy, and you didn't have any flow come out. Because if you even had flow now, I'll have said, okay, maybe you took something that was too strong for you, and at the end of the day, that's why you've had the miscarriage through the flow that you had, and that is why you can no longer see the pregnancy. So please, anytime we feel that we are pregnant, let us get to the lab and run blood pregnancy tests just for us to be sure. Thank you.
Please, doctor, I have been married for 2 years now without child. Anytime I meet with my partner, whenever I stand up, everything will pour out back. And I have been seeing this discharge for some years now.
Okay, fine. In that issue then, the problem is not yours, it's your husband's. So what you are going to do is, it is advised that your husband should get to the laboratory, run what we call a semen count culture and analysis test, just for us to rule out if there's any form of infection and to know the level of its motility and activeness of a semen. So please, what I advise you to do is, let your husband run the test, and then you get back to me.
Doctor, good morning, ma. I'm a girl of 21 and my breast is bringing out water. I'm not pregnant and I have not been pregnant before. Please help me.
That is an issue of high prolactin. That means your hormone, your prolactin hormone is very high. It's on the high side. That is why you are having water come out from your breast. Thank you for telling me that you have not been pregnant before. So definitely what I advise you to do is run an hormonal profile test. It's because of the high level of prolactin that you are having discharge of water come out from your breast. So get to the laboratory, tell the lab scientist that you want to run hormonal profile test. Once you run hormonal profile test, you'll be able to now know why your prolactin is high and the kind of medications to be able to give to you to stop the water from coming out from your breast, because they are still very, very young.
Myself and wife have been married for 6 years and been treating staff which did not go. Early this year, we now discovered Escherichia coli, and after treatment, symptoms remain. What do we do?
You know, none of us do not finish taking care of the infection. Like now, you said you were treating staph earlier on. Now, what you have now discovered now is E. coli. To start with, I'm sure it's either you didn't finish your dosage of the medication, and so staph reduced to E. coli, and that is why you are now having a reoccurrence of E. coli again. It's always best that if you're given to take medication for 2 weeks, you don't need to stop because you are now feeling better or you feel the symptoms have reduced. Make sure you finish taking the medication for that particular period of time that you're giving, so that you have a perfect health. So now, since you still have E. coli, it's still advisable that you still have to continue with the medication, so that at the end of the day, you are free from any form of bacteria and you have no growth. So what you're going to do right now is, you can put the number on the screen, we give you medication, and then you'll be fine.
Doctor, I'm 24 years old, I'm married. I always feel strong sexual urge each time I sleep with a woman. I will not even spend a minute or two before release. I have done urine and blood tests, but they said nothing is wrong with me. Please advise me.
There's actually nothing is wrong with you in the actual sense. The only problem you have is that you are too over anxious. You are overexcited at the fact that, you know, even before you want to meet with your partner, you are so much anxious that even the urge, you already have the urge already, because you want to meet with your partner. You understand me? And which really will make you to ejaculate quickly, because they are so anxious, you know, even right from your mind, from your system, you are so registered that, oh, your partner is coming today, and before you know it, immediately you just go into her, you are going to release. So my dear, what I would advise you to do is, anytime you have to meet with your partner, you don't need to be anxious. Just take it easy, take it calm. She is yours and she will still be with you. So why are you now so anxious? And because you want to have her, You know, as the fact that you are anxious and so the anxiety is there, immediately you go into her, it will come down. So you don't actually have any problem. Your problem is just remove anxiety and relax and be calm.
Doctor, please, can lung infection cause low ovulation? I'm married for 4 years without a child. I have not conceived once.
Yes, a very long-standing infection can cause no ovulation, because at the time that your ovaries are supposed to be releasing eggs, the infections have eaten up the eggs that the ovaries are supposed to be releasing. So how do you want to ovulate? There's no ovulation and there can't be pregnancy. So if you're married, according to you, I think you said you're married. If you're married, you have to treat yourself and your husband. Take care of the infection off your way, and then you can now ovulate properly. And you know the truth about it is that the fact that you are not ovulating now, definitely your husband's semen would have been watery as a matter of that infection too. So right now, what I would advise you to do is pick the number on the screen, give us a call, we'll give you medication. Once you clear the infection from your body system, you ovulate normally like a woman. Your husband's semen count too is okay. We both meet, and in no due time you carry your pregnancy and you are carrying your bundle of joy in your hands. So please kindly pick the number and give us a call.
Doctor, myself and fiance do meet sometime. He easily come quickly. What is the cause of that? If we decided to use protection, he takes long time to come. We are planning to get married, and I love him. Please, what can we do?
This is a very funny one. If he doesn't use protection, he comes easily. If he uses protection, it doesn't come easily. Does protection really have anything to do with him ejaculating on time, having a premature ejaculation? I think your husband needs more of counseling than treatment. You know what you would do? Since you're the one that you are watching me, kindly give your husband my number. Let him give me a call by himself. Then myself and him will have to talk one-on-one, and I'll be able to ask him exactly where the problem is coming from.
Good day, doctor. Please, I feel movement of something in my private part and itches in my private. What could be this? Okay,
itching in private parts is infection symptom. Now, if you're a woman, I would advise you that you run a swab culture test. If you're a man, I would advise you that you run a semen culture test. Now, because if you're having an infection, you have itches in your private, and which will be making you very uncomfortable. So, like I said earlier on, if you're a man, run the test. If you're a woman, run the test, and then you can get back to rest.
Good evening, doctor. Since last month's period has been delayed, it comes always on the 27th instead of 23rd, and this month it hasn't started. Please, what do I do?
Okay, now your menses are now shift. That's what we call irregular period flow. Yeah, in that case, maybe probably you took some drugs, or you did some stressful things, or you did some stressful exercises. You understand me? And that will now interfere with your menses coming out at the time they're supposed to come out. You understand me? But what I advise you to do is, number one is just run an hormonal profile test. And if at the end of the day you find that okay, you are still not getting it, then you pick the number and you give me a call.
Good evening, doctor. I listened to your program. The problem is that my monthly period stopped 4 years ago, ma. Please advise me on what to do. Thanks.
4 good years ago, monthly period has stopped. And although you didn't tell us your age, that's very, very long a period of time. And for 4 good years, there's no how you can be pregnant. You should know that you're not actually not pregnant. And for 4 years, your menses has not flowed. Number first test to run is run hormonal profile test. It has to do with your hormone. 1, 2, run swab culture test, run urine culture test, and at the same time run a pelvic scan test. When these results are out, then you now call me back. Then we can know the reason why your menses has actually ceased. Oh, my viewers out there, I'm sorry we have to go now. I'm sure you've had a blast, and I promise you next week it will even be more interesting and more revealing than this episode. So please make it a date with us, same time, same station next week. For now, I say bye-bye. over time there has been the reoccurring issue of irregular ovulation. At times the woman does not even see her ovulation at all. This is what the medicals know as, or even call as, an ovulatory cycle. There are various segments like the doctor's perspective, Silly Penny with a healthy recipe, healthy tips, and Ask the Doctor segments. My name is Dr. Margaret. You're welcome back, and this is our Doctor's Perspective segment, and today we'll be talking about an ovulatory cycle. An ovulation means lack of ovulation or absence of ovulation. Ovulation, which is the release of an egg from the ovary, must happen in order to achieve pregnancy. If ovulation is irregular but not completely absent, this is called oligo-ovulation. Both anovulation and oligovulations are types of ovulatory dysfunction. Ovulatory dysfunction is a common cause of female infertility, occurring in up to 40% of infertile women. Now that takes me to what are the symptoms of anovulation. Usually women with anovulation will have irregular periods. Now when I say irregular period, it means that if your cycle are shorter than 21 days or longer than 36 days, you may have ovulatory dysfunction. Now what I mean by that is, a normal day, that some women, normally you might not necessarily have 28-day cycle, but if your cycle is shorter than 25 days, that means maybe you have 20 or you have 21, then there's something wrong somewhere. Or probably you have a cycle that is longer than 36 days, then there's something wrong with your ovulatory system. Now also, if your cycle falls within the normal range of 21 to 36 days, but the length of your cycle varies widely from month to month. What I mean by that is, 1 month your period is 22 days, and that period you see it again in the next 35 days, and that period you see it again in the next 40 days. You will definitely have problem with your ovulation. In order for you to avoid this, make sure you know the number of days of cycle you have, and then it will be easier for you to calculate your ovulation time. It is possible to get your cycle on an almost normal schedule and not ovulate. That's very possible, though it is not common. There are some people that they have a normal cycle and they are still not ovulating. The other reasons are responsible for that. So please, a menstrual cycle where ovulation does not occur is called an anovulatory cycle. I'm sure you can get that. Very simple. Now that takes me to, how can anovulation and ovulatory dysfunction cause infertility? What is the relationship between anovulation and fertility, or infertility in other words? When a woman is anovulatory, she cannot get pregnant because there is no egg to be fertilized. Now, what are the causes of anovulation? Anovulation can be caused by a number of factors. The most common cause of ovulatory dysfunction is polycystic ovarian syndrome, which we call PCOS. When you see, for a lot of people that have polycystic ovarian syndrome, we find out that they are actually not ovulating, because when you have PCOS, it says that you have more of male hormones than the women hormones. So that's number one major cause, which is PCOS, that's polycystic ovarian syndrome. Number two is you're being obese, that's obesity. When you are overweight, you have problem with anovulation. So that is why I always mention that if you're going to exercise in moderation. Make sure you are not underweight and you are not overweight, because obesity contributes a lot when it comes to your ovulating. Now the third one I like to mention is too low body weight. Like I said earlier on, that's being underweight. You must not be underweight. You must have a normal body mass index to be able to achieve pregnancy in no due course. Another I'd like to mention is extreme exercise. It makes your hormones not function properly. So because of that, you have to be careful of the kind of exercises you are getting involved in when it comes to ovulation. Let us minimize our exercises, and don't let us do too much of strenuous type of exercises. Now, another one I like to mention is hyperprolactinemia. That's a very common cause also. Hyperprolactinemia means when you have high level of prolactin. When you have high level of prolactin, definitely your level of progesterone will go low and you are not going to be ovulating. Automatically, no ovulation. And the best way you can use to know whether you have hyperprolactinemia is when you get to the laboratory and you run what we call hormonal profile test. So this now, they will now run about 4 different tests for you. With this, you can now detect whether you are ovulating or not. Now, another thing I like to mention is premature ovarian failure. Once you have problem with your ovaries and there's a failure, definitely then you just know that you are not ovulating, because that is at the time that your ovaries are supposed to rupture, it is failing, it is not rupturing, and automatically no ovulation. Another cause I would like to mention is extreme high level of stress. As a woman, you need to cut down on stress. You are not a man, so please let us minimize the rate at which we stress ourselves. If you have to work and minimize stress. Stress really has a lot to do when it comes to ovulation. The last point I would like to mention is thyroid dysfunction, either hyperthyroidism or hypothyroidism. Your thyroid level should be moderate, it should be balanced. It shouldn't be high and it shouldn't be too low. Now, how is an ovulation diagnosed? One of those tests that you can use to diagnose whether you are ovulating is when you run a blood test on the 24th day of your cycle. After ovulation, progesterone levels should rise. So if your progesterone level does not rise, you are probably not ovulating. So the first test to use in detecting whether you are actually ovulating or not is what? Running a blood test. We call it hormonal profile test. Running a blood test on the 21st day of your cycle. So once you run the test and your progesterone level is high, automatically you are ovulating. But if you find out that it is low, then you are not ovulating. The second test that you can use to detect that also is what we call folliculometry. Folliculometry in the sense that you use an ultrasound scan to test for this, starting from the 10th day, to know whether you are actually ovulating, because from the 10th day they'll start monitoring the rate at which your egg is maturing until the day it will rupture and you are now considered that you are ovulating. Those are the 2 basic tests. Okay, I'm sure we'll be able to pick 1 or 2 things from what I've just discussed. What an ovulation is, how we can detect whether we are ovulating or not, and the basic causes of an ovulation. That is all we have for you on today's episode of Doctor's Perspective segment. Please stick around. We have so many other interesting segments still lined up for you.
To run a test on 34 organs in your body, you can contact Dr. Margaret on 0807 176 7592 or 0803 778 3305.
There you are. Welcome to Healthy Recipes. I'm Celia Penny, your diet designer. I've had text messages coming in, and people have been asking about the soy milk that we made before in the past and what happened to the leftover or to the residue or something like that. Now, what came out of that milk after extracting the milk, the fiber that was left, you know, of course, still having a lot of milk inside of it, or turned to whey. Look at it. See, the milk is coming out. You can see the milk. So what you do, if you have a bigger sieve, because this is just to demonstrate what happens and how you can preserve this. So what you do is that you press out as much milk from it as possible. You don't need any oil in the pan, or you can oven dry it. Okay, you can oven dry it. If you put it in your oven, okay, if you put it in the oven and then let it dry, or just cook slightly until it gets really crispy, that'll be really nice. Okay, so this is exactly what you do when you're frying gari, and the end product is just going to look like gari anyway. So you keep turning it and make sure it doesn't burn. Just make sure it doesn't stick and it doesn't burn. See, it's getting drier and drier and looking more like gari. Okay. Now look at it. That's it. There's practically no difference between that and your gari. Look at it. Look at that. Let me just make a comparison between that and the gari that we have, yellow gari. You find that hey, there's not much difference in color. Look at it. So you can use this. You can add this to gari. You can use it in place of egusi in your soups, or you can add it to your soups, your egusi soup. It makes it more chewy and healthier because of the protein content. I do hope that you got a few tips that would help you make the right choices and prepare your meals in a more creative manner. Until next time, remember that when it comes to your health, everything matters. I'm still a Penny, caring for you.
For sponsorship and advert placement on Mother's World Care, please contact Bimbo on 0807 176 7592 or 0803 77 778 3305.
Welcome back. Yes, this is our Ask Your Doctor segment, which we all know as the Q&A segment, where a lot of people are seated already wanting to get replies to all the mails and SMSs they've sent to us during the week. Alright, the first question says,
Doctor, I need an urgent attention on this my infection. It's eating me up.
Urgent attention that you need is urgent treatment. So I think wherever you are, you can pick the number on the screen, give us a shout, and then we can tell you where to meet us depending on your location. Definitely, I can tell you, once you're there, we'll give you the right medication, you use it, and by the grace of God, this infection that is eating you up will definitely have no choice but to leave you alone. Thank you.
Good morning, doctor. I'm Ellen from Bayelsa State. Just last night, I went to pass out feces, and I discovered that blood was flowing out of my anus with the feces. It is the first time that I'm seeing such thing. Please, doctor, help me.
Alright, madam, for you to go to toilet and you find blood in your feces, that shows that you have what we call dysentery. I think what you need is just need medication, and then this blood can stop, because if it continues, it might cause other harms to your body system. So what I advise you to do is quickly pick the number on the screen and give me a shout, and then we can talk. Immediately medications will be given to you, then you can have a sound health.
Good day. Please, I need your assistance. I'm infected with staphylococcus. I have taken injections and local herbs. It only subsides but came back later. Now, it gives me boiled inside an offensive odor. What can I do?
The truth about it is that, like I always say, a lot of us, we take the medication and we don't complete our dosage. I mean, in the case where you're taking medication and you don't complete the dosage, what do you expect? It will reoccur. It will definitely come back to you, and you will not start complaining. So it's always fine for us that once our doctor tells us you go on 1 month treatment or you be placed on 2 weeks treatment of antibiotics, make sure whether or not you're relieved a bit, or even if all the basic symptoms you were feeling from the start have disappeared, it's better for you to complete the dosage. Now, when it is completed, you get to the laboratory and rerun another culture test just to find out that you don't have any bacterial growth. Once you are not sure that you don't have any bacterial growth, fine, no problem. You can live your normal life. So please, what I would advise you to do, since you still have the infection, kindly call us, then we can give you the medication, and then you have a good health again.
Dr. Margaret, I noticed some unpleasant things in my private part for quite a long time now, but I couldn't bear it any longer. The problem is I see some boil, and sometimes it will go and movement only on my private part. And early morning, I also see pus sometimes. I have gone for urine culture test. The test observed nothing. Please advise me.
Everything you're going through, you have just mentioned now, are symptoms of particularly staphylococcus infection. Though you have not mentioned anything about you going to the laboratory to run a test. But what I advise you to do is, I think you're a lady. If you're a lady, you get to the laboratory and run a swab culture test and a urine culture. Now, but if you're a guy, or a man rather, please, you run what we call a semen count culture and analysis, and please include a urine culture. I'm sure a lot of us will be wondering, why am I including urine culture? Why I include urine culture is because most times you find out that when they run the swab culture or they run the semen culture, there are times that they don't actually find the bacterial infection in any of this, either the swab or the semen. So at the end of the day, we find out that the infection is particularly in the urine. That is why I always emphasize that when you are running a swab culture, include a urine culture. When you are running a semen culture, include a urine culture. So please, my brother or my sister, if you're a man or a woman, please run either of the tests I've just said, and then you get back to me.
Good day. Please, what are the causes and solutions to sick and weak ovaries?
There are a lot of reasons why you might be having weak ovaries. Like I said, there's what we call premature ovarian failure. Now, but you have not said anything, you have not said, well, probably maybe that is what you are going through. When you say weak ovaries, weak in what sense? So I think I would prefer you calling me. You pick the number, give me a call, let us talk one-on-one. Thank you.
Good day, doctor. My period comes on the right date, but I have lighter bleeding. The colors didn't change.